Is the American dream failing the very workers who build it? Welcome to a deep dive into the state of workers' compensation in America, an issue that is as complex as it is contentious. At the heart of the matter lies a question of fairness, of a social contract between employers and employees that seems to have been skewed in favor of the former. Workers' compensation is a form of insurance providing wage replacement and medical benefits to employees injured in the course of employment. Yet, the system, which is supposed to protect workers, often leaves them in the lurch. To understand this, one must first navigate the legislative landscape of workers' compensation. Each state has its own laws and systems for workers' compensation, leading to a patchwork of policies that vary widely in terms of benefits, coverage, and accessibility. For instance, in some states, workers' compensation covers mental health conditions related to work, while in others, it does not. This inconsistency creates a system where the treatment of injured workers largely depends on geographical location, a factor that should ideally be irrelevant. Despite the varying state laws, one common thread ties them together: a trend of decreasing benefits. Over the past 3 decades, many states have enacted laws that either limit workers' compensation benefits or make them harder to receive. Injured workers are often caught in a maze of paperwork, with their benefits hanging in the balance. Now imagine a scenario where everyone, regardless of employment status, has access to medical care. This is the promise of Medicare for all, a proposed healthcare system that could potentially change the game for injured workers. No longer would medical benefits be tied to employment, reducing the reliance on workers' compensation. However, the path to Medicare for all is fraught with its own challenges, including political opposition and funding questions. The experiences of injured workers shed light on the stark realities of the current system. Stories abound of denied claims, delayed treatments, and financial hardship. These narratives are not just anecdotes, but symptoms of a system in dire need of reform. But who speaks for these workers? Who advocates for their rights at the legislative level? The unfortunate truth is that on this federal human rights issue, no one is representing America's workers. It's a void that needs filling, a cause that needs champions. The time for change is now. It's about fairness, it's about dignity, it's about holding up our end of the social contract we have with our workers. Advocate for workers' rights, stand up for fair compensation, demand that your representatives take this issue seriously. The state of workers' compensation in America is not just a workers' issue, it's a human rights issue. And it's high time we treated it as such.